It is 6:20 by my computer, and I think we're all on. So why don't we start with, I'll call the meeting to order and we can do the Pledge of Allegiance. I pledge allegiance
to the flag
of the
United States of America
and to
and
the
to the republic
for which
it
it
stands,
one
one
nation,
nation,
under
under
God,
God,
indivisible, with
with
liberty
liberty
and
and
justice
justice
for
for
all.
all.
Great, thank you. Were there any public comments or any emails? I certainly haven't gotten any, but any, comments, Lucy or Taylor, that we need to bring forward?
No, nothing, just, nothing out of the ordinary, just usual COVID related.
I will say that at the flu vaccine clinics, both of the ones that I was there, obviously the police officers were all very friendly and happy to take advantage of the drive-through. But the families, I thought, were particularly appreciative. I think, we should note that in the minutes that they were very appreciative, even when we had families that had 4 people in a car and different ages and, all kinds of circumstances. I think the longest anyone from beginning to end was probably like 12 minutes. I mean, it was phenomenal.
Also, I can't remember her name. Well, for the 2 that I saw who were administering the vaccinations, they were so sweet with the kids and very gentle and they really did a great job with the kids.
Yeah, and I thought the teamwork amongst all the nurses, if somebody had a car that was behind and only had one person, they go back, well, here, I'll quick do that one. People really work together. But I think that the families were extremely appreciative that they could drive through one-stop shopping, get the vaccines for the whole family in 14 minutes. I mean, that's pretty, oh, Taylor, we can see you now. So I think that's really something and certainly bears being in the minutes.
Yeah.
I'd like to say thank you to Lucy, because we went through as a family and it was terrific. And it was easy and it was great. And Sam is amazing because my son didn't even flinch, which
Well, your kids are actually the most well-behaved children.
that day, not always.
Yeah, it seems like there's less screaming when we have the drive-throughs.
I think there is. It was a lot easier.
Mm-hmm. Well, they don't see all the other children getting upset or whatever, and it's for whatever reason, it really, I think the families were very appreciative. So Amy, how long was your time?
Less than 15 minutes.
Yeah. And there were 4 of you, and there were a couple of cars that had some people in them that took a little longer. And if you got behind, it's like the grocery store, if you got behind the wrong aisle, it might have taken, a little bit more time, but truthfully, I don't think anyone was more than 14 or 15.
No, and it would have been just like that if you had walked in. You would have been at least that by the time you got out of the car and you walked in with the kids and you got them all situated.
Yeah, absolutely. Thank you for your comment. All righty. So why don't we move on then to review of the minutes from October 14th. They were in the email. I did not see any changes that I was going to suggest. I will entertain when you're finished. I'll entertain a motion to accept them when you're done reading.
I'll make a motion to accept the minutes from the
Amy.
October meeting.
All righty, and I need a second.
I second it.
Deb, all right, all those in favor? Aye.
Aye.
All righty, so the minutes are accepted as written. And now Lucy, October Health Department Activity Report.
Okay, so Obviously, it's long, yeah. I want to just welcome Taylor. She is our new administrative person in our office. She is taking the place of Joanna, and she's been doing a wonderful job. So, especially right now, it's crazy, like I said, with all the billing going on for insurance, with the flu vaccines and all that. So it's a lot for her to learn all at once. So
So you did join at the peak of activity.
yeah, that's what I told her. So if she can handle this, then
Right.
she'll be fine.
That's right.
So just a lot of same kind of meetings with the Board of Ed, the state. We finished up all our flu clinic planning. We are working on our mass vaccination planning for the COVID vaccine. So just continued meetings about school closings, school exposures.
What's the latest status? I'm sorry, Lucy, to interrupt. What's the latest?
Schools?
Yeah.
So schools are closed right now until November 30th, and then we'll revisit that.
Oh, so no hybrid or nothing?
It's fully remote right now for middle school and high school.
What about the elementary?
That is in session. Remote. Or no, it's not at all? All right, so that's full remote.
It's remote. Yeah.
Okay.
Oh, elementary is remote too?
Mm-hmm.
Okay.
And then we'll
Amy, yours, the private school as well?
Our private school actually ended up closing before the Trumbull schools did because we had a bunch of cases.
Okay.
Wow.
What else? So for meetings, that's about it. We have been doing all of the, training Taylor, doing all of the billing, all of that upfront work that Joanna has always done. So it's been kind of crazy just doing all of that.
Did you give every single flu vaccine?
We did over 750, something like that. I think last year we did up in the 800 range. We still have some left. We're doing some walk-ins, but we'll be able to, we got rid of some of it. We gave it over to Stratford, and we'll be able to return some of it. We just didn't have, we didn't have the big Board of Ed clinic. One of them got canceled because of the weather. So we didn't need as much as we did last year. We will also be going back to the original protocols they put in place with the town, with town hall being appointment only. And so November 30th will be going to just appointment, no walk-ins at our department as well, because of the increase in cases and just to, limit the access of people going in and out. So that being said, we're not going to have, if we do have walk-ins for the vaccine, there won't be as many as we did in the past in the month of December, January. But I mean, we still did, I think, a really good job with the vaccine and giving out, almost up in at least 750.
Yeah.
Compared to.
I do think this year a lot more people have gotten the flu vaccines than ever before, even patients. It just seems like more people have been motivated to go to pharmacies or wherever, I think because everyone's concerned about COVID and the infection of the flu. So I think you may get more people that haven't come in because so many have gotten it already.
No, oh, good point.
Mhm.
And it seemed like the pharmacies were just constant. Whereas I don't think that the pharmacies did as much in the past. I mean, that's just anecdotal. I can't say you had a lot in your office then, Glenn.
We have some in the office still, but and most of the people have gotten it already by the time they get to us.
Okay.
But yeah, we did run out early on. We weren't able to order more. Then the orders got backed up and they were delayed. So we had issues with that. So we ended up buying some from Stratford. And then when we finally did get more of it in. It had gotten to the point where we had, you know, we had to cancel some of our clinics due to weather and all that kind of thing. So, but that being said, we'll return it, so we won't have an issue with that. We received funding, or in the process of receiving funding, $7,400 for the COVID vaccine that will go towards refrigeration, any supplies needed, any staffing. The COVID, the ELC, I'm sorry, go
Has
ahead.
the state told you anything about how it's going to be distributed or any more information, whether it's going to be?
So as
these
of
are you
right
guys-
now, it looks like we will be doing critical workforce, and it will probably be the Moderna one, which is the refrigerated vaccine. There is a platform that they use, it's called VAMS, and that will do the scheduling with the critical workforce and making sure that they come and get their second dose. You have to wait 28 days in between the second dose of the vaccine. We're not sure yet in terms of how much we're going to get. That depends, again, on who they identify as, you know, which portion of the critical workforce is going to be vaccinated first, whether it's the police or EMS. So
You
we
have
might-
enough refrigerator space to hold however many they give you?
Or do you
So-
have the right type of refrigeration? Isn't
Right.
it a special?
Yeah. That's what this grant is for. So they let you, once they give you the specifics on the vaccine, they give you a calculation to determine how large the refrigeration is and how much vaccine you can hold in this unit. And that's what this money will cover. It'll cover that, the cost of that.
So sort of following up to Glenn's question, who's defining the critical workforce and who gets it first? Not to get into politics, but I've sort of read some information. The two administrations seem to have potentially different opinions on who should be getting it first. So you're getting your information from
The state.
Connecticut.
Mhm.
Okay, and they've defined, they haven't actually defined yet.
They defined it. They gave us the task of coming up, getting all the list of all of these who they identified as critical workforce. So police, EMS, fire, and anyone else that was on that list. And we had to gather all of that information.
Okay.
And then as we get
For example,
closer,
like healthcare workers or the elderly, they're at the back end of that list, or are they on it at all?
they don't know. As of right now, it could change. We don't know who is going to be in the first, batch of it, of the vaccine. So we just have this big list, and they're going to determine that as we get closer to it, the distribution.
Is there a date on that distribution?
It looks like as of right now, they're saying December.
Okay.
And
Well,
then
but
there's also, whether or not people are willing to get it. So we might have, say, 1,000 doses, we might only get 100 doses. And then out of that, whether or not the people on that list want it will determine who it goes to next.
Right.
You're going to get a whole lot of, with the efficacy being so high, I think you're going to get a lot of people that are going to want it.
Mhm.
And the safety studies so far seem pretty good.
So Glenn, you think that, there's, been a lot of jazz with politics going on, but you feel people will feel comfortable?
Yeah, I think people feel comfortable. It went through it the right way. It wasn't rushed through the way it was going to for the election. It went through the right way with the right studies. Fauci came out saying that it was done the right way. And there are people looking at the stuff. The efficacy has been very good. And what I've heard is the safety studies seem pretty good also.
Okay.
So I think there's going to be, there's going to be a big demand for that. And it's going to depend on the list and how that who gets first.
Okay, all right.
We did develop a survey for all of the critical workforce that was sent out to determine who would be willing to get it, who isn't. You know, if you're not willing to, why not? So we're just waiting to get more of those surveys back, just to kind of see where we're at.
Well, it certainly, I had read that the next administration, that some of those physicians on that Biden's committee or team, I'm not sure what it's called, I'm sorry, we're thinking that maybe the vaccine should go more globally than at home. So that's why I was just wondering if, you know, kind of who was defining what and where it was going to go. But it sounds like it's being defined and plans are being made and it's all good. Okay. So we sort of interrupted you. You were doing your
That's okay.
activities.
And then, did everyone get their annual report? I sent that out too.
Good job.
Thank
Yeah,
you.
Good
just,
job.
can you drop the E off my name next time?
What is it? It's an E on your name that shouldn't be there?
No. Joanna,
Okay.
she always made sure it wasn't on there, but I know with transition.
Yeah, it's been a little hectic.
Yeah.
DEBBI? DEBBI?
EBBI, yeah.
Okay.
No E, okay. Got it. Okay, the VOC platform that we use to report all of our cases in town, that is also updated to reflect all of the cases in the schools, staff in the schools. That
Hey,
is something that
Lucy,
yeah,
have you noticed, just because of what I do too, we haven't seen any Bridgeport Hospital results come in since the end of October. Have you seen any?
I would have to look. I don't, off the top of my head, know when I'm putting them in. I don't necessarily even put in the
Okay.
lab. That's something that Sam does too.
Okay. I'm just curious if it's just Fairfield's not getting them or if they're not reporting in general.
Okay.
And have you seen an uptake in both of your areas that reflect what we're hearing in the news? And
Yeah, there's definitely a big increase in cases. But at least in our town, not how it was in the beginning in terms of the elderly population, in terms of hospitalizations, deaths. So that's, you know, a good thing. I think a lot of it too, we can attribute to the fact that there's more testing. And, you know, that's obviously part of the problem. There's increased testing, but there's not enough of availability.
Yeah.
I'm
So we're
testing
getting-
still.
Yeah, there's people are waiting 4 hours in line to be tested. So
Wow.
that's a huge issue. But for our town employees, we did partner with Progressive Diagnostics. So we have it set up for emergencies with employees who are exposed and need a test. They can go right to the health department or to EMS and have a PCR done, and then they'll get their results within 2 days. So at least we have access to that. We just started this week, so we'll see how it goes. You know, obviously we're on just continuing to answer calls, concerns related to COVID, exposures. There's a lot of concerns and a lot of, I would say that just in general, people are definitely, they're amping up. Their fears definitely increased
Oh,
like it was in the beginning. So just a lot of some calls, you know, just wanting information, some irrational. So we started a whole COVID hotline just to keep up with the volume of calls that are coming into the health department.
really?
Because we can't even answer the calls. That would be just a full day job just doing that. So we have that set up now. So when you call the health department, you get a phone tree, you'll get a prompt for any COVID questions or concerns, press 1 or whatever it is, and it'll go to that. And then we, every day we'll go into that line and go through the questions and
That's a good idea. Can you leave, some information that they can hear first that might decrease the number of people leaving a message?
no, because we post all of that information up on our page, and it's really everything that we're getting. They're really
Just not
specific
paying attention.
questions. And a lot of the times, even with the information that they're given, they want to just speak to someone, and they want an answer. So, and they want it right then and there. And that was the other issue that we're having is, with Taylor just starting, if she's answering these calls, I don't expect her to answer COVID questions, so.
Yeah, those should be going to either
Yeah.
a clinical person or someone who's,
Right. And like I said, it's just with everything else that's going on, it's difficult to keep up with just the emails and the calls coming in. So
Glenn, are you finding in your office that you're getting a lot of calls of people with questions on COVID? Or Dr. Kunkel, are you getting questions?
I get a lot of questions from MinuteClinic that I cover.
Okay. I wonder if there's a fact sheet or so. I mean, you already have a fact sheet on the,
Yeah. it really doesn't matter, Nancy, how much information that you send out.
Yeah,
Just don't read it.
okay. No, I understand that. People are sort of panicked and they just want to
Mhm.
talk to someone.
Are
They
you
want to
getting,
talk to someone, or it's, a specific situation where somebody is tested positive and now they want to know who needs to quarantine and who doesn't and what do I do. And so it's not something that they would necessarily get the answer from something that we put out.
are you
I
getting,
will say people are really appreciative once they talk to somebody and they go through it and then they feel so much more comfortable. So
Okay.
it's
Yeah.
burdensome, the amount of calls, but I mean, the public after you talk to them is really thankful.
I find a little mix of both. I think that we have been getting a lot of nasty calls lately.
Oh,
And that's another reason I set this up. So I think they're just, a lot of people are, rightly so, they're scared, but just angry.
well, I've
that,
heard
you know,
people
situation.
complaining that people are not wearing their masks correctly.
Yeah.
Either they haven't got on their chin or their nose is exposed. People who are actually, and this was going to be my next question, working in, not necessarily our Trumbull restaurants, but have you come across that where any complaints about the workers not having the mask on totally over their nose?
Yeah. I mean, we get calls constantly,
Yeah.
complaints about anything and everything, you name it.
Yeah.
So
Oh, hi, Richard.
hi, Richard. I'm just trying to think if there's some way we can make this easier on you, but obviously.
yeah, it'd be great if I had 10 more staff. And that would help. And 20, 25, 30 hours more in the week, but that's not going to happen. So
Yeah.
I think a big problem with that too, though, is because they're the longest calls to answer.
Yes.
So
Yes.
when people call, you can't just say like, oh, quarantine for 2 weeks, bye, or something like that. They keep you on the phone up to I know last week, Lucy was on the phone for half an hour with somebody. And that was just one person.
Yeah.
and that's just it. If they, a lot of these people are, employees, and they're looking for, they want a particular answer. And if you don't give them the answer that they want, then that's when they get angry, and
They're looking to get sick time or something like that.
things that we have no control over. So, it's difficult, but it is what it is. So.
So obviously you say to them, I'm not in charge of, HR policy, blah, blah, blah. I can tell you how long you need to be quarantined and just deal with it.
Right.
But yeah, okay. That makes it hard.
Any chance though, Lucy, that you could get some extra help?
Well, yeah, I was thinking, could you get a temp?
Mm-mm.
No?
Nope. That was actually a call I got the other day. Some lady called and was yelling at me that I should get more help and that it was my fault.
Since you're not answering the phone fast enough?
No, that how could I not have asked for more help?
Well,
That
how
I
does she
need
know
to
how
go
much
to the-
help you
Yeah, how
have?
does she
Yeah.
know who's in
I
there?
mean, yeah, because that's my, I'm in charge. You think that I haven't asked? You think that I don't want that? You think I want to work 60 hours a week?
Yeah, really.
So,
Give them the right telephone number.
Yeah,
yeah.
town hall.
I
Yeah.
did. I said, call, you could call town hall. Go ahead.
Yeah.
So,
Great.
But yeah, I mean, the grant that we got for contact tracing, all I was able to do with that is give Joanna an extra hour, give Sue an extra hour a week. And then with the rest of it, Sam, our nurse, is now she works full time,
Yeah.
but that's it.
Wow.
We have a little bit of money left in the COVID crisis funding. I think it's around $5,000, but that has to last until March. And I'm sure I'm going to be utilizing some of that for Joanna's overtime for her, helping out. And so,
Just throwing this out there, maybe it's a terrible idea. Some of the nurses that volunteered to give vaccinations, do you think that you might be able to recruit some of them for a few hours, or that, to even have 2 hours a day or 3 hours a day? I don't know. I'll make it up. Let's say you've got 5 people and we each picked, I could do 2 hours, someone else could do, and you could have someone help going through that. If you gave us talking points that we, you could educate us. And
the problem, so obviously we don't want anyone in the office. Because,
even
yeah.
wearing masks and distancing, you don't. Okay.
No.
They want us to rotate our schedule right now, and we can't do that for obvious reasons. So to put
Okay.
more people in that small area is not the best thing to do. And I mean, I guess we have 2 interns now that are working on some projects for us, but it's almost like it creates more work than it actually helps, because then you have to oversee them and you have to, if we had to have someone answer the phones, we really need somebody who has done it and really knows what to say. Otherwise, it's just they're going to answer it wrong and it's going to end up coming back to us. You know what I mean?
Can you shift some other, I'll make up a word, easier work? I'll make it up, typing, something, I don't know, and shift that to the interns, and so that you and the others who are actual employees could pick up. I'm just trying to think of ways. Can we pull some work off your plate?
I think the
somehow?
biggest thing right now, Nance, is just getting Taylor up and running.
Okay.
And Joanna's been helping out because that is a whole full-time position.
Yeah.
So
Yeah.
just trying to juggle that with everything else, that is what's difficult. And and obviously it's difficult. She's not going to pick it all up in a week or 2 weeks.
Sure. No, it takes months to get.
Right. So, and she's doing a great job. It's just,
It's a lot.
it's a lot. And I feel bad because, like we said today, I don't have time to sit down with her because there's 6 meetings and then another one pops up and then the calls and the emails. So, I would love to be able to keep Joanna on just for, even if it's, a temporary thing, and just have her do certain things, just even the billing for the insurance.
Well, who would you have to talk to? The first selectman?
No, she's been doing that already. Like today she came in, she helped Taylor a bit. But she's in finance, and so they've been working with us to do anything that we need, but it's just difficult when we really need that full time and she's only able to give us 2 hours,
Yeah.
Okay.
So yeah,
I'm just trying to think if there's any way we can try to help you and shift work off your plate. I mean, obviously you're an exempt employee, but I heard you say 60 hours a week. Been there, done that, and it gets pretty tedious.
yeah,
So I'm just trying to think if you can think of ways that we can be supportive.
Yeah,
Whether we can go to bat for a temp help, or we can, I guess we can't come in, but if you can think of anything that we can do as a board to support all of you and try to help relieve, the cork from popping and helping to get some work off your plate, all of your plates, please, give it some serious thought and, ask for us to help you if there's something you can think of.
yeah. I mean, it's concerning because if we get into a predicament where someone's sick or, it's
Yeah.
not even COVID, but anything
Yeah,
else,
yeah,
then, then what? So,
yeah, you can work, you can work at, I would always say, you can work at vacation staffing for just so long, and then, you have to put everybody back in place, and you can just do it so long.
mhm.
I'm going to go back to asking for temp help. Should we go to the first selectman and say that we absolutely need either Joanne to work a certain number of extra overtime hours for your department, or a temp secretary that could answer the other phone calls from a talking points or something. I mean, we could write her a letter and say that, you're exploding. This is just,
Yeah, I mean, it's been brought to her attention. I know there's other departments that are in the same boat and they've asked. So,
yeah, but this is the health department. I mean,
I
this is
know, I agree. I've said the same thing. So,
different. This is
yeah,
not, the building department. I'm sorry, but
So, yeah, I either we can write another letter, just a short one, just the number of hours everybody's worked, the extra hours, and that you absolutely need, whether it's 20 hours of a temp secretary that can come and help answer the phone. I know that it's more work to try to get a temp person up and running, but even if you could get, I'll make it up, 10 weeks of 20 hours, and it takes the first 2 to get them up and going, it could potentially, help relieve everybody from, you all working 60 hours. I mean, that's nuts. Well, it's not nuts. I know what you're saying. You're being responsible, but I don't know. I'm more than willing to write something. I think the board would be willing. I think we're all, I'd certainly be happy to have a phone call conversation. Give me some data and I'll throw it forward. I'll do whatever works. But
and I do hope they keep this all in mind when the budget
yeah,
thing comes.
oh, well,
that's what I'm thinking ahead here about.
Yeah.
well, they have to, and we'll be there with you if we
Yeah,
need to. I mean, that's,
Yeah.
this
And the
is,
other part of that too is our nurse really should be, she's full-time now, but that's only because we received that grant.
right.
And I have, we wrote that letter and we had that conversation, but I really don't know if we didn't receive that funding that she necessarily would have been approved for full-time. So that's something that needs to just continue, whether it's grant funded or not. And we could have utilized that grant money,
For other,
for an
Yeah.
epidemiologist or some other function within our department that would have
or some more
alleviated
additional
our-
nursing hours. I mean, if it's already full time, you could have used some more additional nursing hours.
Right.
Because certainly, you gave 750 flu vaccines, and we're in the same situation we were last year, that I'm guessing 75% of them were given by volunteers and students, or maybe less this year. But, again,
I would say Sam definitely did the majority of them.
all right. But,
Yeah.
again, you're talking to 50% of an important function of your department's done by volunteers. How long can a department sustain that? I don't want to get off on a tangent. Sorry.
Yeah.
But, if there's, given it some concrete thought, is all I'm asking. Give
Right.
it some thought. If you feel there's some way that either we could help you or getting temp help that we could justify, I'm willing to go to bat. I'm sure everybody here is willing to go to bat.
Yep.
Amy, I mean, how is your department coping with this same dilemma?
So
You have
we're
a larger department, right?
Yeah,
Yeah.
Fairfield's much bigger, and we have actually we're doing contact tracing in house, and so we've actually hired 1,
See?
2, 3, 4, 5, I think 6 or 7 part-time, 1 full-time, and 5 or 6 part-time who are doing contact tracing.
Yeah.
Just contact tracing. So we're much bigger.
So when you're a bigger department, you can spread the work around and you have the budget to be able to add additional staff.
Right.
Right. I mean, because really all we have is obviously Taylor, she's full-time, but in terms of, anything related to COVID, we have Sam, she's full-time, but she also is in charge of all the flu vaccines and all of the other vaccines that we're doing. And the other full-time is the sanitarian, Quaisha, but she's doing all the inspections. So really all the calls and everything related to it, it's Sam and I.
And in December, you're going to potentially start giving COVID vaccines.
Yeah.
2 doses to each person, 28 days apart or something. Did I hear you say?
Mhm. Yep.
Maybe
So-
we need to think about a letter.
Yeah.
I mean, is the first selectman, it's very hard to, I mean, it's easy for someone to say, oh, well, I know you're busy, but the specifics, she can't possibly be aware of the specifics of how this is impacting your department. Maybe if we could, make certain she's aware of the specifics of how this is impacting and
Well-
how other departments, in surrounding towns are hiring more help.
Yeah.
I have had Vicky, I will say she's been very receptive and she has reached out to me personally because she does see these things other towns, and I think Fairfield came up, and so people don't understand, I think, how one town is doing this and they have all this staff and the other town isn't.
Right.
I explained everything to her, exactly what goes on in the office. And so I think she's aware of it. It's just, I don't know how easy it is to change it.
But this is an epidemic. I mean,
Yeah. And I know the town income is down because taxes and so I get it. I know it's frustrating. All righty. Well, we beat that horse for a while, but
Yeah.
why don't you, give it some thought, see if there's anything, think outside the box, if there's some way we can be supportive.
All right, I appreciate it.
Anything, other urgent things that you want to talk about in terms of your activity report?
We are still, believe it or not, processing ticks. We've been getting a ton of them. Despite everything, like I had said last month, we are still looking good in terms of our financial intake. We, like I had mentioned, we do have a couple of interns, so they're working on some projects. And the blood pressure grant, emergency preparedness grant, we are still utilizing all of that. I think that's pretty much it for old news. And then the next thing to talk about, I wanted to bring up the meeting schedule for next year, but we could talk about that.
I'm going to make one last suggestion, so I'm going to give this horse one more beat. I know that there are certain things that you have to do for the grants.
Yes.
So all of those activities you have to maintain. Look at some of the other ones, like you said, ticks or something. Are there any other things that you could say during this pandemic, we will no longer be doing blah, 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 and blah until it ends? I know that's outrageous, but let's think about it. Are there some things that you could eliminate that would free you up or free up staff
Mhm.
that you might be able to say during this pandemic and tell Vicky, say, we cannot provide all of the services that we typically do because unless we either need more staff or can't do everything.
Well, I think what we might do, the state just issued a letter, I think it was yesterday, saying that they are recommending we limit field work and field inspections, which they should have sent that out in the beginning of this, and we did that on our own, meaning, restaurant inspections were limited and that kind of thing.
Okay.
So that being said, I think what I might do is have Quasia pull back on just routine inspections for restaurants, and use her in the office more with the phone calls and anything like that. And she already has been in the office more, but I think that, I'm going to give her some more tasks that aren't related to what she normally does, just to
Okay, I
free up
see
that
Amy
time.
shaking her head, yes.
Yeah.
See if you can go through all of the tasks that everyone does and see if there are some other things that can be eliminated that we're still following public health rules and we're still following the grants and whatever. But see if there's some other things that you can pull off people's plates to try one more way to, help you. Amy, is that a stupid thing to say?
No, I mean, I definitely think the state coming out with the field work guidance was very helpful to kind of make it universal that we should be not out there in that tiny little kitchen doing a restaurant inspection for an hour with all those people who are probably sick with COVID.
Yeah.
So, I mean, we've pulled back a lot. I'm actually working remotely right now, so I've been working at home.
Oh,
So.
Okay. Well, maybe you could on one-on-one have some suggestions for Lucy too, because you're sort of in the thick of it. You know what Fairfield is and isn't doing or whatever, that maybe you could help. Okay, I promise.
For sure.
I won't say any more related to that.
I think too, once we close the office to the public after Thanksgiving, that will help.
Yeah.
It's just having people coming in and out, even though it's not a huge volume now because of the flu season being pretty much at the end. Especially in my position, I get a lot more done when I'm working at home because I'm not having to answer the calls and the meetings and you know what I mean? So I'm going to try to do that more. But I don't, again, Taylor is there. She's new and I don't want to overburden her with, all of the things that she's not used to yet. So,
Okay.
but we'll work on it.
All righty. Good.
So.
Thank you. All right. So we finished your activity report. So we have old and new business. I think we did bring up a lot of things as you were talking, but are there any topics under old business that people would like to bring forward?
I just wanted to say that I thought the booklet that you sent to us was very well done.
The annual report.
Yeah, the annual report looked really nice and showed just how much you've been doing.
Yeah.
Which is good.
Agreed. Very professional.
Yeah.
Next year it'll probably be all COVID, right?
Yeah. Well, except that you're still
hopefully
doing a
not.
lot plus. Any new business?
I have new business. Hold on.
Okay.
I gotta show it to you. Come here. It's good new business.
Okay, good.
And then that's it. Can you see him? That's the new little puppy.
Oh, he's so sweet.
How can the puppy help?
Yeah, that's her stress.
That's my stress relief.
Yeah.
So,
Sanity.
Yeah.
exactly.
All righty. Is there anything else that anyone feels we need to bring up, discuss, other than welcome Taylor and thank you, Lucy, and thank you to everybody. Anything else? Okay. I'll entertain a motion.
I make a motion
for adjournment. Thank you, Richard. And do I have a second?
I'll second it.
All right, Amy, and all in favor?
Aye.
Aye.
Have a
All
good
right.
night, everyone. I'll
Sorry
talk
it
to you
Night.
soon.
was longer than
Night.
usual, but nice to meet you.
Nice to meet you,
Kara, and,
Kate.
uh,
You
Nice to
too.
meet you.
Thank you.
Nice to meet you.